Hi, everyone. My name is Alexandra Luzier. I am the Vice President of Business Development and Communications with Accessible Pharmacy Services, and it is my pleasure to announce the 2023 winners of the Accessible Pharmacy Services Vision Healthcare Awards. This is our first year doing these awards, and our goal with it was really to highlight and celebrate amazing individuals and organizations in the blindness and health community. We wanted to showcase leaders doing incredible things and working towards inclusive futures for us all. We have 11 different categories with 2 winners in each category. So, without further ado, let's get started. Our ophthalmology winners are Dr. Akriti Shukla and Dr. Tomas Alaman. Dr. Shukla is the Leonard A. Lauder Assistant Professor of Ophthalmology at Columbia University Medical Center. She received her medical degree at Columbia University's College of Physicians and Surgeons, where she completed her ophthalmology residency and served as chief resident. She pursued further glaucoma subspecialty training at the Wilmer Eye Institute at Johns Hopkins University in Baltimore, Maryland. She was an assistant professor of ophthalmology at the Wills Eye Hospital prior to relocation to New York. Dr. Shukla has published over 70 peer-reviewed articles and book chapters and has been invited to speak nationally and internationally on patient care and research. She has received research grants and several awards, and her research interests include structure-function relationships in glaucoma, optimization of surgical outcomes, and sustainability in ophthalmology. She is passionate about trainee education in the clinic and operating room and is committed to excellent clinical care. Dr. Alleman is an Irene Hines Given and John Laporte Research Professor, attending physician with the Department of Ophthalmology at the Hospital of the University of Pennsylvania, and the director of the Retinal Structure and Function Laboratory with the Perelman Center for Advanced Medicine at the Perelman School of Medicine in the University of Pennsylvania. Dr. Alleman has extensive expertise in the study of hereditary retinal degenerations. Most of the studies in which Dr. Alleman is an investigator are aimed to lead patients with these incurable retinal degenerations into clinical trials, as well as in the detailed characterizations of patients, both children and adults, with these conditions. Dr. Alleman cares for children and adults with retinal degenerations, hereditary or acquired, at Shea Eye Institute and at the Perelman Center for Advanced Medicine. He is also a staff physician at Puentes Clinic. He is the co-principal investigator of a gene therapy trial for choroideremia. He is also responsible for all clinical electrophysiological investigations within this department, which provides this service to a large number of specialists in the region. Congratulations to both Dr. Shukla and Dr. Alleman, and thank you both for your work and dedication. Our optometry winners are Dr. Erin Kenny and Dr. Kelly Scherer. Dr. Erin Kenny received her bachelor's degree in biological sciences from the University of Pittsburgh. Upon graduation, Dr. Kenny obtained her Doctor of Optometry from PCO at Salus University. She completed her residency at the Eye Institute in Low Vision Rehabilitation and is a fellow of the American Academy of Optometry. In 2016, she received the William Feinblum Low Vision Award and the Alfred A. Rosenblum Jr. Low Vision Residency Award. Dr. Kenny is currently a faculty member at Salus University, which includes a role as chief of the William Feinblum Vision Rehabilitation Center and associate professor. She enjoys teaching 3rd and 4th year optometry students about the field of low vision rehabilitation and is a preceptor at the WFVRC. She is an advocate for the interdisciplinary approach when managing individuals with visual impairment. Dr. Kelly Scherer is a low vision optometrist who has devoted her career to improving the lives of individuals with visual impairments. In her role as Director of Clinical Services at the Chicago Lighthouse over the past 5 years, she has been an integral part of her interdisciplinary low vision rehabilitation team of optometrists, occupational therapists, and mental health care providers. Dr. Scherer's primary focus has been on patients facing complex and advanced ocular disease resulting in visual impairment, and she provides compassionate, high-quality care with a strong emphasis on practical solutions. She consistently goes above and beyond to ensure her patients have access to a diverse range of resources and support services, including accessible pharmacy. Beyond her clinical care, Dr. Scherer is a passionate advocate for individuals with vision loss. She actively promotes the expansion of access to low vision care and contributes to the field through clinical and educational initiatives, providing education on low vision rehabilitation to healthcare providers, optometrists, optometry students, and the public. She is dedicated to enhancing the quality of life for those with visual impairments through clinical care, education, and advocacy. Congratulations, Dr. Kenny and Dr. Scherer. Our winners for Certified Low Vision Therapists are Kristen Shiflett and Elsa Zavoda. Kristen Shiflett is an occupational therapist who specializes in low vision. She has been a part of Johns Hopkins since 2006 when she first started working at Johns Hopkins Bayview at inpatient rehabilitation. Johns Hopkins Bayview is a certified stroke rehabilitation center, so Kristen started focusing on vision rehabilitation with neuro patients. In 2012, she completed a low vision certificate program from University of Alabama, Birmingham. In 2013, she transferred to the Wilmer Lyons Low Vision Rehabilitation and Research Center to focus on providing vision rehabilitation to patients full-time. Over the past 10 years, Ms. Shiflett has focused on finding ways to educate the community about low vision by presenting it at local and national conferences, participating in education of the local Lions clubs, mentoring therapists and occupational therapy students who are interested in low vision practice, and starting a peer support group, See Us Network, with patients from Low Vision Clinic. For research, Ms. Shiflett is focusing on improving the overall rehabilitation process for patients with vision impairment as a secondary condition. Her current study is focusing on educating and training physical therapists at the outpatient therapy level about visual strategies to apply for functional mobility activities. Elsa joined Vision Loss Alliance of New Jersey in 2016, and she is the Vice President of Programs. She is also a practicing occupational therapist since 1997 and is dedicated to her career to practicing exclusively in the field of low vision since 2006. She participates in the program team in creating, designing, and implementing new, exciting, and innovative programs to serve the needs of those with vision loss and blindness in New Jersey and beyond through a variety of methods, including center-based, community-based, and virtual program options. Elsa has also established a center-based outpatient occupational therapy model under the medical model of low vision rehabilitation, which launched in 2018, and she has most recently launched a similar mode in September of 2023, the Vision Loss Alliance of New Jersey at-home program, providing the convenience of occupational therapy services to individuals in the home environment to ensure safety and independence in completing their daily living tasks. Thank you for everything you both do, Kristen and Elsa. Congratulations on your awards. Our winners for Certified Orientation and Mobility Specialist are Tara Brown Ogilvie and Katarina Eller. Tara Brown Ogilvie is currently the Research and Accessibility Specialist at Helen Keller National Center for Deaf, Blind Youths and Adults. Her role is to support a robust research program, collaborate with universities, and provide consultation on the inclusion of individuals who are deaf-blind in research activities. She has enjoyed over 10 years of working with youth and adults who are deaf-blind as a support service provider, vision rehabilitation therapist, tactile sign language interpreter, Helen Keller National Center regional representative, and certified orientation and mobility specialist. She is also a National Leader Consortium in Sensory Disabilities scholar pursuing a PhD in special education at University of Northern Colorado. She also holds a Bachelor of Science in Sign Language Interpreting and a Master of Science in Education with an emphasis on orientation and mobility. In 2019, she was awarded the Division on Visual Impairments and Deafblindness Virginia M. Sal Student of the Year Award, which recognizes a student committed to the education and rehabilitation of individuals with visual impairments and deafblindness. She has co-authored several articles related to visual impairment, deafblindness, and disability support services. Tara has also worked as an adjunct instructor and enjoys guest speaking at university classes, professional in-services, and conferences on deafblindness, transition services, communication access, and orientation and mobility instruction. Katarina Eller, born with low vision due to ROP, received her bachelor's degree in modern languages, German and Spanish, from Elizabethtown College in 2011, and her orientation and mobility certification from the University of Pittsburgh in 2020. She has been working at Vision Corps as a certified orientation and mobility specialist, serving adult clients with blindness and low vision since January of 2020. Along with providing O&M services, Katarina helps to facilitate 3 educational support groups. 2 of these groups focus on general mobility education and life as a guide dog user, while the 3rd group is a Spanish-speaking support group called Sin Limites, translated to Without Limits. Before becoming a certified orientation and mobility specialist, Katarina worked for 2 summers with Vision Corps as a volunteer receptionist and as an interpreter for a vision mission trip to Ecuador through World Blindness Outreach, which provided eye surgeries and rehabilitation training to people with blindness and low vision. She loves to read, go on walks, and visit every coffee shop in the city where she works. Congratulations, Tara and Katarina. Our winners for Certified Vision Rehabilitation Therapist are Jamie Pressman and Megan Hayden. Jamie has a master's degree in vision rehabilitation therapy from Salus University and is certified through the Academy for Certification of Vision Rehabilitation and Educational Professionals. She has been employed with the Office of Vocational Rehabilitation and the Bureau of Blindness and Visual Services for over 16 years. She started as a social worker in the Wilkes-Barre District Office, working with individuals of all ages in Berks, Lehigh, and Northampton counties. Jamie used all of her VRT skills during Summer Academy, Junior Summer Academy, and other similar group training programs. She became a vocational rehabilitation specialist in the Special Programs Division in 2021, where she is involved in a variety of projects. Jamie manages the Newsline program for OVR, assists in coordinating staff trainings, and presents at statewide conferences. Jamie is currently serving as a VRT intern supervisor for Salus students. She also assists in special program development and implementation. Additionally, she gathers all of the data and completes the RSA 7OB report that is submitted annually for the Independent Living Older Blind program. Megan says, I've been working with the Sight Center of Northwest Ohio for 13 years. For the past 8 of those years, I've been working with people who live in Central Ohio, expanding the Sight Center's scope to assist people with vision loss from just Northwest Ohio to include 12 counties in Central Ohio. I conduct evaluations and then provide training to help people in the areas of low vision, orientation and mobility, and adaptive daily living skills. These trainings take place in people's homes, places of work, and in their communities. I've enjoyed working with a wide range of people from different backgrounds, ages, abilities, and types of vision loss. It has been such a privilege to work for the Sight Center because this organization cares so much about its mission to empower independence and enrich the lives of people who are blind or visually impaired. I appreciate all that Accessible Pharmacy is doing to support this same mission. We appreciate everything that you both are doing for our community, and thank you so much. Congratulations, Megan and Jamie. Our winners for blind students pursuing careers in healthcare are Mohammed Duma and Prashurna Sayus. Mohammed is currently studying for his Doctor of Pharmacy at Binghamton University. He says, my college journey began at Binghamton University, where I pursued a Bachelor's of Science in Biochemistry. This experience led me to explore the world of pharmacy, and so I entered the 3+4 program for Binghamton University School of Pharmacy and Pharmaceutical Sciences. I started the first year of my Doctor of Pharmacy this fall, and I am excited about the challenge ahead. Although a career in pharmacy leaves me with an abundance of excellent career paths, I aspire to enter as a pharmacist working in the pharmaceutical industry. Basharna is studying a dual degree of nursing and psychology at Stony Brook University. She told us, "I'm 22 years old and I am visually impaired. I'm very passionate and dedicated about everything I do. I currently attend Stony Brook University, where I am pursuing dual degrees in nursing and psychology. I've been interested in healthcare since middle school because my school had a career day where many different professionals shared their passion for their career. The amazing conversations I had with healthcare professionals sparked my interest in the field. I wasn't exactly sure what I wanted to do, and I thought my disability would limit me to opportunities in the healthcare field. Around this time, my sister, who also had the same eye condition as me, shared that she was accepted to nursing school. This was a pivotal moment in my story because she proved to me that I could pursue a career that many thought was impossible. From there, I researched many different career paths, spoke to professionals, and decided to pursue a career in nursing. Aside from nursing, I also have an interest in psychology that began with a course I took in high school for college credit. Psychology was my first major before nursing school. Thanks to Stony Brook's dual enrollment, I am able to pursue both of my career passions. After graduating nursing school, I will work as a registered home health or psychiatric nurse. In the future, I plan to get my master's in nursing education. After a few years of experience, I want to return back home to Haiti and open a health clinic to serve my community and others in need. I would also like to start a nonprofit organization that provides resources to children who are blind or visually impaired around the world. I am excited for the future that I've envisioned for myself. Mohammed and Basharna, we are so excited for your future endeavors. You are both so inspiring. Congratulations to you both. Our winners for Diabetes Educator are Kim Ladd and Abby Chesterson. Abigail Chesterson is a registered dietitian and certified diabetes care and education specialist. She has over 8 years of experience working with patients with diabetes. In her current position as the director of the Diabetes Education Center at Pennsylvania Hospital, Abby leads a team of registered dietitians and certified diabetes care and education specialists who work with patients to increase their understanding and mastery of living with diabetes. The Diabetes Education Center at Pennsylvania Hospital works with patients with all types of diabetes and takes special interest in those with blindness and low vision. The team takes pride in helping people live longer and healthier lives with diabetes. Kim Ladd is the diabetes educator, health education specialist for the Virginia Rehabilitation Center for the Blind and Vision Impaired, Virginia Department for the Blind and Vision Impaired. The mission of the Virginia Rehabilitation Center for the Blind and Vision Impaired is to prepare blind, vision impaired, and deafblind Virginians for the employment and employability and personal independence through the integration and individualized comprehensive blindness skills and employment skills and experiences. Kim supports this vision in her role as the diabetes educator and health education specialist by educating and empowering vision impaired clients to independently manage their diabetes and other chronic diseases with the use of adaptive techniques, low vision aids, accessible devices, and problem solving so that they can be healthy enough to live the life they imagine. Her mission is for no one to let blindness be an excuse for not taking care of their health. Kim has been a registered nurse for almost 30 years, having received her RN diploma from Richmond Memorial Hospital School of Nursing and her Bachelor of Science degree from Bellevue University. She is also a certified diabetes care and education specialist, a certified professional in healthcare quality, a master trainer for the Stanford University developed diabetes self-management and chronic disease self-management programs, and a certified American Red Cross instructor. After having taught diabetes self-management in the home, health, and community settings for years, she began working at the DBVI in 2015. Thank you for everything you each do. Congratulations. Our winners for veterinarians specializing in service and guide dogs are Dr. Kelly Wilson and Guiding Eyes for the Blind. Dr. Wilson works with Leader Dogs for the Blind. She says, I graduated from Wayne State University with a Bachelor of Science in Biology, and from there, I attended the Michigan State University College of Veterinary Medicine. Upon graduation, I spent 12 years in small animal private practice. I joined the Leader Dogs for the Blind team in 2007 as the Assistant Director of Canine Health. During my time here, I have served on the advisory board for the Baker College Veterinary Technician Program since 2008. I have achieved academy status in the Southeastern Michigan Veterinary Medical Association, receiving over 50 hours of continuing education annually since 2005. We welcome our fourth-year veterinary students to our clinic for externship and have mentored over 170 students during my time with Leader Dogs for the Blind. I am very passionate about our mission, and I truly love my job at Leader Dogs for the Blind. Being a veterinarian is a wonderful job, but being able to help dogs as well as people in my role brings the job satisfaction to a whole new level. I consider myself very fortunate to be one of only about 12 veterinarians in the US that can claim that they work for a guide dog organization. The people and dogs that I am privileged to work with every day are truly an inspiration to me, and I am forever thankful for the opportunity to work at such an amazing organization. Guiding Dogs for the Blind is an incredible organization that provides guide dogs to individuals who are blind or who have vision loss. Their mission is to increase independence by pairing people with a wonderful, passionate, and confident dog. Founded in 1954, Guiding Eyes for the Blind has a team of dedicated veterinarians working to maintain the health and safety of their dogs. Congratulations, both Dr. Wilson with Leader Dogs for the Blind and Guiding Eyes for the Blind. Our winners for Nonprofit Health Committee are Tom Tobin with the American Council of the Blind Diabetics in Action and Stacy Leap with the National Federation of the Blind of Pennsylvania's Blind Parents Group. Tom told us, I was elected president of the ACB Diabetics in Action, ACBDA, in June of 2021. Over the past 2+ years, our special interest affiliate of the American Council of the Blind, ACB, has experienced tremendous growth and success programmatically, financially, and in our membership. In 2021, ACB Diabetics in Action stood up our Peer Mentor Relations Program, which is based on the peer-to-peer support model, a very effective way for peers living with diabetes and vision loss to assist and support one another. Currently, we have 14 mentors and 21 mentees. Moreover, we have expanded our community call offerings, providing our community with a monthly Living Well with Diabetes education call, typically with a subject matter expert and a specific topic impacting individuals living with diabetes and vision loss. In addition, in 2022, at the request of our members and friends, we expanded our Friends Helping Friends casual chat calls, offering our members and friends an opportunity to gather twice per month in an open forum to discuss whatever is on people's minds, again, based on the peer-to-peer support model. We have also achieved tremendous membership growth over the past 2+ years. Between 2021 and 2022, membership in the ACBDA grew enough to enable us to secure one more affiliate vote, bringing our total vote up from 2 to 3. Other programs and services we are proud to include a website filled with information and podcasts, annual convention programming, a quarterly newsletter. ACB Diabetics in Action has seen so much success over the past 2+ years, and we offer our members so many benefits and perks. It has truly been a labor of love, and I'm tremendously proud of our officers and board members who are the ones who are making it all happen. Stacy Leap lost her eyesight in 2016 as a result of domestic violence and intimate partner violence. As Stacy learned to adjust to her blindness, she also learned how to be a new single mother. She began seeking services within the state and local communities in order to gain the knowledge and training needed. With the Bureau on Blindness and Visual Services, along with the Associated Services for the Blind, now known as VisionLink, she was able to learn how to use a white cane, access technology using screen readers with her phone and laptop, manage household tasks and Braille, and she connected with Educating Communities for Parents, a local nonprofit, where she attended parenting classes and connected with parents of blind children. Even though she is not a parent of a blind child, Stacy attended their meetings in order to know different blindness adapted techniques. This landed her with the National Federation of the Blind. She currently serves as the chair of the Blind Parents Group with the NFB of Pennsylvania. There, she leads peer support groups, book discussions, and health seminars for blind parents and grandparents monthly via Zoom. She partnered with Turning Points for Children to hold a workshop series on the powers of positive parenting. There was also a book discussion on the 7 Habits of Highly Effective Families, where various members of the Blind Parents Group helped and co-facilitated. She partnered with the Pennsylvania Association of Blind Students and Accessible Pharmacy to have workshops on medication management as blind parents. The group also provides a safe space for blind parents and grandparents to discuss their successes and challenges in parenting and give an opportunity to seek peer guidance and advice. Even though she has lost her eyesight, she's never lost her vision to empower herself and those around her. As a survivor of domestic violence and a blind parent, she discusses her journey on various podcasts, conferences, workshops, and conventions throughout the country. She hopes that through her interactions with people, stigma about blindness is minimized and barriers to accessibility are diminished. She wants people to understand that blindness does not hold her back. Blind parents are capable, and she can live the life she wants. Her biggest motivators for her advocacy, and drive are God and her daughter Elena. Congratulations, both Tom and Stacy. You are both so inspiring. Our winners for technology are Orcam and Be My Eyes. Orcam assistive devices empower people to be more independent by making the visual world audible. Orcam's AI voice-controlled digital smart cameras are for people with reading and print disabilities due to blindness, vision impairment, learning, and reading difficulties. Orcam's revolutionary devices take visual information and convert it into audio in real time. No connectivity needed. Options are the My Eye unit wearable on eyeglasses and Read a handheld unit. Both have a stationary stand for tabletop use, and features include the new What's in Front of Me descriptive guidance, facial recognition, smart reading, and the new all-in-one customizable reading solution visible on a screen. Orcam really does increase daily activity independence for thousands of individuals worldwide. Be My Eyes was launched in 2015 and has created a global community that connects people who are blind or who have low vision with volunteers or company representatives. On the app, volunteers assist blind and low vision users through a live video connection and work together to tackle inaccessible parts of life. With the specialized help feature, blind and low vision users can connect with company representatives for accessible customer support. This year, they have released Be My AI, a new tool that integrates OpenAI's latest generative AI technology, GPT-4, to describe images, providing an unprecedented level of accessibility and power to the 285 million people who are blind or who have low vision globally. And lastly, our winners for ocularistry are Walter Tillman and Dave Legrand. Walter Tillman is an ocularist in Pittsburgh, Pennsylvania. We are so thankful for his work in the blindness and low vision community. He has helped so many individuals with their artificial eyes, and in doing so, he has increased their confidence and independence in their daily lives. With technician training and in the fitting and fabrication of artificial eyes. Dave is an ocularist, and he served his ocularist apprenticeship under his brother, Joe Legrand, in Philadelphia. He earned a diploma from the American Society of Ocularists and is certified by the National Examining Board of Ocularists. He has been on the editorial board of the Journal of Ophthalmic Prosthetics for over 20 years, and he is currently the co-chairman of the Education Committee. 3 of his articles have been published in a journal titled Going for a Mission and Returning with a Purpose, The History of Plastic Scleral Cover Shells, and a review of the book Long Time No See. We are so grateful for both of your work in the blind and low vision community. Overall, we were so happy to put on our first Vision Healthcare Awards this year, and we were even more thrilled to work with all of these individuals and companies and be present in a community with such incredible individuals doing such amazing work. Thank you all for your passionate and dedicated service. Congratulations. If you were able to watch this video, and you want to read more about all of these individuals and learn more about their work and their companies and organizations, please click on the links below. All of their information is detailed below. Thank you so much.